Hi everybody, I am Dr. Smrithi Nayak. I am a fertility specialist and laparoscopic surgeon at Aster RV Hospital in JP Nagar, Bangalore. Today I will be talking to you about how to prepare yourself while collecting a sample for semen analysis. Although it's a very common done procedure, a lot of the patients out there, a lot of men out there don't know the right way, and so here I want to throw light on what all preparations you need to do before as well as during collection of the sample. So point number one, first and foremost, abstinence is very important. You should not have ejaculated out a sample either through intercourse or masturbation for at least 3 days before you plan to go give your sample for a semen analysis. This will help to keep the report accurate and does not lead to unnecessary wrong reports which show low sperm count as well as low sperm motility. Having said this, the abstinence should not be for a very long duration of more than 7 days either, because that will also lead to a lot of dead sperms as well as immotile sperms in the analysis report. So anywhere from 2 to 5 days of abstinence is ideal before you plan to go and give your sample for analysis. The second is, before the analysis sample is given, avoid having any alcohol or any unnecessary drugs like antibiotics, which can again cause problems with the reporting. Prevent having any stress or having travel plans just before you go and give a sample for analysis, because that leads to inaccurate results and unnecessary interventions will be required at that time. Moving on to while collecting the sample, you will have to make sure that the bottle that is obtained from the lab is a sterile one and maintained that way. Before you collect the sample, please make sure you wash your hands with soap and it is collected in the most hygienic environment. Once the sample is collected in the container, make sure the entire sample is put into the container and there is no spillage. If there has been any spillage, make sure it is reported to the laboratory technician so that they can guide you to come back at a further time to give another sample. Once the sample is collected, please make sure you go and give it in the lab within 30 minutes of collection. This rule is applicable even when you collect the sample at home, because if you give it at a later point after an hour or 1.5 hours, again that leads to inaccurate results. Make sure you have a healthy lifestyle before you plan to give your semen analysis. A healthy diet also goes a long way in giving good results. I hope these tips have helped you in understanding how to prepare yourself before giving a sample for semen analysis. Please make sure that these tips are followed, and also understand one thing is that the semen analysis is not a fixed report once you get it. With proper treatment, the parameters which may be abnormal can definitely be normalized. A lot of my patients are very stressed out when they see reports which show abnormal parameters, and they think it is completely fixed and it cannot be changed. But let me assure you, with the right lifestyle choices and the right medications, semen parameters can be normalized and definitely patients can help with having a healthy pregnancy.